Good morning, all. Good morning, Dr. Arya, Atira, Sufia, Shiny Korean, Nancy,
Good
Dr.
morning, ma'am.
Anita, Lata,
Morning, ma'am.
Rosalie, Suresh Kalburgi, Nuha Anwar, Brahma Vidya Jayashree. Once again, deep gratitude to all of you for giving me this space for reading our Guru mentor, Dr. Praful Vijay Kasar's book. So, once again, welcome you all to our reading club. And now, today, we are reading the book that is the end of my assumption of miasm and few more chapters to go. And we have been dealing with the miasms in and out. So, we have dealt with the soric miasm, we have dealt with the psychotic miasm, and we have dealt with the syphilitic miasm. We know the inflammation, the process, the inflammatory process, the construction process, and the destruction process of all the three miasms, respectively. Just a minute, guys. So we know the process, the physical process, the disease process of all these miasms. And you know that if the disease has to appear in the body, the mind has to get that particular kind of thought process. Without the psychotic mentality, the patient will not get the psychotic disease. If the patient is coming with a psychosis disease, you already know that the thought process will be psychosis. Or if the thought process is going towards a syphilis, you know that the disease in the physical form is going to go to the syphilitic miasm or into the destructive phase. So this much can be assessed mathematically. Okay. So we have dealt with all the soric mind, the psychotic mind, and the syphilitic mind thoroughly in detail in our previous classes. And today we are going into a next very, very interesting multi-million dollar question, that is miasms, good or bad? We all have said that miasms are nothing but defense mechanisms of the body, and syphilis is destruction, and psychosis is construction, and psychosis is cunning, malicious, lie, and all. We don't want to be all of that. We all want to be good people. So we all don't want psychosis. And syphilis means it is death and destruction and all the necrosis, gangrene, everything. Even in the mind, the gangrene and the poison happens in the mind also. And we don't want to be syphilitic also. Now what to do? We all don't want to get aged, and we all don't want to die. We all don't want to get cancer. What can we do? But is there an escape? Dust to dust, every man must. So this is the rule of nature. Everything in and out, everything will perish. Everything has to change, and everything will grow older day by day, grow older and grow colder day by day. And finally, we all will meet with our last day in our life. And everything in the body, like inside our body and outside our body, will perish, and everything is made up of nothing but the Panchabhutas. So the macrocosm and the microcosm, everything is made up of Panchabhutas. Even a stone, even a big mountain, even the snow layers of Antarctica, even the snow mountain Himalayas, even the Rocky Mountains, everything will have to dwindle down over the period of ages, over the period of years. And the man and any living organism, plant, animals, everything will have to perish one day. And they all will merge with the soil or merge with the air or merge with whatever, no, all the panchabhutas. It will be dwindled down into its elements. Which are the elements? Like the earth element, water element, fire element, air element, and the ether. So everything will be dwindled down into its own parts. So our cells are also made up of all these things, and anything which is outside the body, the living things or the non-living things, everything is made up of the panchabhutas. So eventually everything will go into the soil, or it will mix up with the air or with water, or that is how it is. So there is no escape of death. If there is birth, there will be death. So we all should have all these miasms. And without death, the birth cannot happen. What does this mean? Yes, for a tree to grow, or it grows first in the form of a seed, in the form of a seedling, isn't it? The seed has to break open. That is syphilis. Breaking is nothing but destruction, the breakage of the covering of the seed, and then comes the life, that is sora. So from syphilis comes sora. So this is a cycle. Life and death is a cycle, as you know, and everything is in the form of a cycle only happening inside the body. And everywhere you see, the seasons, the rotations, everything will be in the form of cycles. So here the seed breaks open, and then comes the sora, that is the life, the plant in the two fronds of the plants. And then it grows. What is that? Growth is nothing but psychosis. It grows into a big tree. There are certain trees which will remain even for more than 400 years. The chinar trees of Kashmir, Jammu and Kashmir, they're all so big and tall. Trees can live for years together. Devadaru, all these kind of trees can live for years together. Even the chinar we have, when we went to Kashmir, we have seen and we have hugged that tree. We can't even hug the tree because it is so big and so girth it is. The trees are so strong. And eventually the tree also has to perish or everything has to perish, and that is nothing but syphilis. So in human beings, before an embryo is formed, what happens? Ovulation happens. What is ovulation? It is destruction. Can we say that ovulation is destruction? Because it is rupture. You all do the follicular study, no? For infertility patients, for PCOD patients. What is the quality of egg? How much is the AMH? Whether a good quality egg is produced. And what happens? The egg will grow and grow and grow from the 11th day onwards. When it attains some 20 millimeter size, what happens? It ruptures. And ruptures means what? It is the scope of a new life. If it is PCOD, what happens? No rupture and there is no scope of life. That is called infertility. People say that these ladies who are having BPCOD, bilateral polycystic ovarian disease, that is the commonest cause of infertility nowadays. All the ladies are having this PCOD complaint. What is PCOD? Utter psychosis. There will be multiple small follicles. Multiple means what? Psychosis. Yes, more than enough, more than needed. Everything is more than needed, but there is no fruit. There is no baby forming because there is no ovulation happening. So when the syphilis happens, what is that? Good or bad? The good syphilis. When the good syphilis in the physiology happens, all the physiologies are not SORA, but then generally, we say the physiology is SORA, of course, because it is maintenance of the body equilibrium. In that, there are so many physiological growth, that is psychosis, and physiological destruction, and that is syphilis. This is a physiological destruction. A corpus luteum cyst will be formed, or whatever, like the breakage of the ovum will happen, and that is a physiological syphilis. What happens? The egg is released, and then comes the sperm, and then comes the fertilization, and then comes the new life, that is the zygote. And what happens? Zygote doesn't stay there. It keeps on multiplying. What is this multiplication? Into blastula, morula, and then into a full formed embryo, and then the structure happens, and then the function happens, and by the 9th month the baby is fully formed. So that is full of psychosis until the 9th month. Good or bad? Good. Psychosis is needed. And after the 9th month, what happens? It cannot stay there for long. It has to come out. Without breakage, how can it come out? The amniotic fluid has to come out. It has to push out. It has to break open the membrane. That is the normal syphilis, the physiological syphilis, and the baby is out. Again, starting with SORA, psychosis, and syphilis. It is said that we people are all born with the three gunas. That is nothing but the sattva, rajas, tamas. Sattva means it is life, or that is the SORA. And rajas means it is the growth, or that is known as the psychosis. And tamas means it is the darkness. Tamas means there is no light. It is utter darkness, and that is nothing but the death. So that is nothing but the syphilis. Sora, psychosis, syphilis, sattva, rajas, tamas. There is the life, growth, death, or in other words, we say it as srishti, sthiti, samhara. So all these things are the cycles of the birth, death cycle, or the cycles which we see in the earth. So these are all explained by our stalwart Dr. Praful Vijayakar sir, and Sahasra Koti Namaskaram for our Praful Vijayakar sir for opening our eyes and bringing out our science so beautifully and explaining things in such beautiful manner. So miasms, are they good or bad? Now coming to the first paragraph. There are a lot of arguments about this miasm being good and that miasm being bad. We know that soric miasms are good. Yeah. So all the sulfurs. Page number is 163. Page number is 163. Yeah. So we all know that Sora is the best miasm, and we want to take birth as Sora and we want to die as Sora. Which is that particular drug in our Materia Medica, which is that medicine in our Materia Medica, which will take birth as Sora and which will undergo all the Sora throughout his 80 years of life, and at the 81st or 82nd or even at the 90 years of age, he wants to die as Sora. The best medicine is the king of soric remedy, which is that Sulfur. Sulfur. Yes. Recently, a person has come to my clinic, and that person was such a cute person, say around 85 years of age, with a broad smile on his face, and the body language, no, like tall, lean, and that stoop shouldered, and then bowed down, and so simple and humble. There is no element of psychosis there. And then what is the patient complaining of? Only certain cracks, or not cracks, now some itching eruptions over the body. How lucky he is. I asked him about the lifestyle diseases. What about your diabetes? I have no diabetes, doctor. What about your hypertension? I have no hypertension, doctor. No dyscholesterolemia, no thyroid, no so-called lifestyle diseases, no unwanted fat hanging here and there, nothing. Very well built, but then now because of the age, he is little stoop-shouldered, and his mind speaks full of Sora. So I gave him very mild remedy. I don't want to suppress. Yeah, because he is at what age? 82. And I explained that you are the luckiest person in the world. I explained him. Okay, so such things happen. So this is only one narration. So the sulfur patients, or the soric miasm is the best, of course. But then, do you think that this person does not have psychosis? Do you think that this person does not have syphilis? Only thing is, he is predominantly Sora. He has psychosis. If there is no psychosis, that is a mistake. And what will happen? There will be growth retardation. There will be stunted growth. There will be cretinism. There will be mental retardation. There will be infantile uterus, or the growth will not be proper. And what is the remedy? The best remedy for inducing the growth? Barytas. Yes, barytas are coming to your mind. Both mentally and physically, the growth will be retarded if the psychosis is not there. So psychosis has to be there. This person also has psychosis, and this person has completed all his life duties and his work, everything. He's completed his family also, and now he is at the ripe age of 82 already. Yes, for the next whatever it is. But then he is. I wish him all the good luck. But then he is so hale and healthy at this 82 years of age, walking fast, up and down, climbing, everything is there, and he is having a very simple lifestyle. Yes. So there are a lot of arguments. This miasm is good and that miasm is bad. Is Sora better than psychosis, or psychosis better than syphilis? All these three miasms have their good and the bad side. All the three are essential for survival of the being and the species. Without any one of them, the human being will not function and will not survive. Without either of them, humans will not suffer or die. Yeah. We all don't want to suffer, and we all don't want to die. And we become 90 years of age. In Malayalam, we had a poetry in our fourth or fifth standard, that is Kalan Illata Kalam. That is, there is no death god. Okay, in our epics, and we will consider even death as a god. Yeah. Huh? Because if there is no death, what will happen? We all will be undergoing all sorts of distractions, and there will be no death. What is the best example of this? Have you all seen this? Yeah. 82 years or 85 years or even 90 years, and there will be certain old grandmothers or grandfathers. Yeah. They will be all shrunken, and no teeth, no eyesight, no hearing, no understanding, and all skin and everything will be like kind of all sorts of destructive ailments will be there. They will be bedridden. They can't get up and walk to piss or shit, or nothing is happening. Everything is happening in the bed, and they are lying down there for 2 years, 3 years in the bed, bedridden people, 2 years, 3 years. Have you seen this? Yeah. And even if it is our mother or father, what we will say, let the death god take them away. Why do they want to suffer? It's not about our suffering too, but we love them, we respect them. It's about our time also. But then how long will a patient lie there like that? Even coma patients. I have given this example of a coma patient who was in the comatose condition for 36 long years. 36, 1 year can you manage a coma patient? 36 years, can you imagine? His children grew up, they got married, they all settled, and still this patient is in coma. And he was a very 6-footer man, and he shrunk and shrunk and shrunk and shrunk, and this much he became. And his wife had to sell everything to manage this person. No house, no property, nothing. And in one room of his, at the mercy of his daughter's in-laws, this wife was, diligent wife was dutifully managing her husband. And the lady's BP was so high. It was more than 210. And sitting in front of me, the lady swayed like this. Then I held her tightly. I asked, what is happening? She said, I'm having vertigo. And I checked her BP, and my BP apparatus did not got broken or whatever. Like that much was her BP. And I asked, what is happening? She said the story. And then finally she asked me like whether any home is there, or because I can't, this is my limit, and I can't look after him any further. He is not died also. What can I do? And finally we gave some address, this, that, and all, and at some home he was admitted. He was taken into the home, and that day he passed away. See, what is the meaning of life then? Is the person knowing everything? Is the person understanding that my wife has put me into some home? Until then, they were anyway changing the whole house, from this house to that house, into from 2 BHK to 1 BHK, and then from 1 BHK to half BHK. They were transferring. But then the wife was there all through, no? All through. Yeah. So when the wife is not there, in that 2-3 hours, the patient perished. So we don't know the meaning of life. Sometimes the patients will open our eyes also, no? Our humanity, our eyes, everything will be pricked by the patients. And there is a slogan, there is a proverb like, disease never kills, only destiny kills. This is kind of that. Because this patient is not having any disease. His heart is functioning. His lungs are functioning. Of course, his brain is not functioning, but then the brain is controlling. Still, the brain is controlling. He is slept off, comatose. And in the other person, the heart, lungs, everything, the 92-year-old and shrunken and lying in the bed for 2 years. Only destiny has to kill them. See, there is no disease in them. There is no cancer, nothing. There is no disease in them. But then due to old age, they are shrunken and shrunken and shrunken, and they are waiting for death to come. So this is exactly what is known as, what we expect syphilis for. Syphilis is most welcome. And we know that there are these young persons, very young persons, like less than 50 years, they suddenly fall dead. That is the latest scenario happening now. Very frequently, we are all reading that in the newspapers and in the medias. So, is there any disease there? Apparently, they are all very, very healthy. Many of them are doctors. They are very healthy, and for no reason, they are all falling dead. So, disease never kills, and destiny kills. We don't know what is that. Okay. So, but then that is the importance of syphilis. If syphilis is not there, then death also will not be there, which is not good for earth, no? So all these three miasms have their good and the bad side. All the three are essential for survival of the being and the species. Without any one of them, the human being will not function and will not survive. Without either of them, humans will not suffer or die. And what is the syphilis that is happening inside our body? You know that the psychosis is the growth. Now, what is the syphilis? One thing is the aging, and one thing is every day we are waking up as a new person, right? While we are sleeping, all the cells are, the unwanted cells or the age cells are all washed away, or they are all wiped off, or they will be engulfed by the neutrophils, or all this clearing process, the cleaning process happens, and that is nothing but the syphilis at physiology. Yeah. So the RBCs, the lifespan of RBC is 120 days, and after 120 days that RBC has to be replaced and new RBCs will be produced from the bone marrow. So all these things are happening in our body, no? So syphilis is also equally important. Now coming to the next paragraph, that is SORA. SORA relates to the first function of survival. It is also concerned with the first defense response of an organism to any calamity that is physical or mental. When this defense is affected genetically, as in individuals born with soric constitutions, or by therapeutic agents or emotions, it becomes pathological and starts troubling the individual. So we are all born with SORA, we are all born with psychosis and syphilis. They are all there in the background. And when the correct situation comes, what is that correct situation? Which is a stimulus, which is an intruder, either a therapeutic agent or a stimulus. The best example is that of a stimulus, mental trauma or physical trauma. Then starts the pathological response. Until then, there will be no pathological response. See, the so-called normal people, we are all said to be normal. Do we have any inflammation anywhere? Maybe we may be soric or we may be psychotic or syphilitic, whatever. Do we have any inflammation all the time? Or do we have a growth, a pathological growth all the time? No. Only physiological growth is there and physiological syphilis is there. But then it goes into pathology when that stimulus comes. It is said the defense mechanism will be triggered when the stimulus comes, when the disease comes in, when the trauma comes in. Okay, are you all with me? Are you able to understand this? Yes? Yeah. Now, the next paragraph is about syphilis. We talk about syphilis as a miasm of destruction. Everything bad is attributed to it. It stands for destruction, distortion, perversion, ugliness, out of control, hysterical, etc. But it has a good side too. The goodness of syphilis. Okay, there is nothing to explain here. Just be closely through the lines, okay? The Almighty has made this world keeping in mind the balance or equilibrium of opposite forces which makes this world go on. Because there is no one-sidedness. It has to be two-way around. We already discussed about the world being made of opposites. If there is black, there is white. If there is a male, there has to be a female. If there is bad, there has to be good. If syphilis has bad qualities, it has good qualities too. The goodness of syphilis lies in the advantage of destructive tendency in the body. The destruction in the destructive response of a cell is basically meant to save the whole by sacrificing a part. The destruction is supposed to be to remove the diseased portion, the cell or tissue. So this is the greatest example of that, thromboangiitis obliterans, where the finger, the digit will be cut off to save the whole. Or there will be debris inside our body, the cell debris or the tissue will be there, and that has to be removed. So to remove the diseased portion, the diseased cell or the tissue from the body. It is a form of cell death designed to eliminate unwanted host cells through activation of internally programmed series of events. It occurs normally in following general settings during the development as a homeostatic mechanism to maintain the optimum cell population in the tissues. The cells in the body go on multiplying incessantly. Growth is the stimulus after every cut. If the cells were to multiply without control, there would be many tags, warts and tumors all over. Extra cells need to be destroyed. Yes. So this is where syphilis comes in. Then the third one is as defense mechanism, such as in immune reactions. This is nothing but, okay. Give me 1 second, guys. I'm so sorry. Sorry, yes. So, so the immune reactions are nothing but the neutrophils going high, isn't it? And they will be creating an immune reaction, or whatever the noxious agents are, it will be attacking the bacteria, etc. All these things are nothing but the immune reactions. Of course, the immune reactions also can be of the soric, psychotic, and syphilitic variety. But then if the syphilitic defense has to be taken, that means according to the intensity of the stimulus, our body will take the best defense mechanism, isn't it? So that is nothing but the syphilitic thing. Then the fourth one is when cells are damaged by disease or noxious agents, when there are dead cells, etc., that has to be cleaned off. And in aging as a natural process. Now, it is the syphilitic constitution which makes daredevil fighters or soldiers. Not everybody can stand there in front of the yes, in the as soldiers, no, that daredevil, that courage should be there. They are there to risk their lives to save their countrymen. When the orders are given, the soldier, whether he is on foot or in air, does not fear the consequences. He attacks without fear, he kills without sentiments or remorse, all for the good of the country. What can a coward and a fearful soldier do at the front? They have they have to be people with a do or die attitude. This is not disease. It is just sheer defense or syphilis of the highest level. Are you all with me? Now, the goodness of psychosis. Yeah. So until now we have talked about the goodness of syphilis. Now we are going to talk about the goodness of psychosis. The goodness of psychosis. What is the advantage of growth tendency in the body? Why has the body been given a tendency to grow? The body, both mentally and physically, is bound to be wounded many times. The tissues, if they were to be destroyed and not regrow at the end of life, a human being would have been in tatters. Thus, the growth tendency in the genes helps to repair what is cut. So, whatever is cut has to grow, and the natural physiological growth should happen in the body. So, this is the goodness of psychosis. At the broader level, people who are born with predominance of growth tendency or the psychosis predominance are the ones who have the mental aptitude for progress. What is that? See, not all the people will be having that kind of an intelligence, no, like to be the top of the CEO at top of a company, or top of the country or whatever, no, like they should be born with predominance of psychosis, predominance of growth tendency. These are the people who will have that mental aptitude of progress. So they will be all thinking about the innovative, progressive thought process all the time in their mind. So they will be good governing people, no? Mankind would never have progressed from ape to modern man if there was no growth tendency or psychosis. To the psychotic brains goes the credit of all the discoveries and intentions. Man encounters many difficulties in progress. He gets over it because of this fertility of the brain. The generals in army and the heads of police or nations have to have psychosis if the nation has to register progress. So that is the good psychosis. Na? All the developments and all should happen in the nation. So such kind of people should be there as heads, as the leaders. So that is the goodness of psychosis. So any doubt until now? Or can we go to the next chapter? Any doubt regarding the goodness of Sora, the goodness of psychosis, and the goodness of syphilis? All good? Yes. Now we go to the, again, another very, very important and interesting. So many questions will be solved by reading this lesson. Chapter number 20, Birth Miasm. That is page number 167. Birth Miasm. Okay. When an individual is born, he inherits his natural traits and characteristics from his parents. These are inherent in the genes. Yes, X and Y or X and X. Not all the genes are being deployed to give this individual a character. Some genetic traits are dormant and some are prominent. So everybody will be having genes. And in the genes, all sorts of everything will be written down there, but then everything will not find expression. or what all things are there in the genes will not find expression. Everything will not be projected out. Many things will be recessive, many things will be dormant. Many bad things, if they are dormant, that is good for the person. Many bad things, if they are dominant, then that will be override, it will be coming out. So we see such things in the genetic diseases. In the same family, many people will be getting the expression of the genes, and many people may not be getting the expression of the genes. So when the stimulus comes in, maybe it will be triggered out, or that gene will be pricked, and then it will show its expression. So if life is good, then even if this person is carrying all these unwanted gene expressions, it will not be, it will remain as a dormant thing if life is good. If life is bad, then all the defenses, everything will be produced out. Some genetic traits are dormant, and some are prominent. It all depends upon which of the genes are not activated and which are activated. If the bad genes remain as non-activated, it is well and good now. That is exactly what is happening in the homeopathic prescription. You know that certain things are happening in certain families. But when you give them a medicine, what happens? The life becomes good. Automatically, the whatever marriage is not happening in the family since many years, that marriage is happening, or the childbirth is not happening, that is happening, or the job, like they get the job. And what happens? The parents, they are living happily with the children. And the whatever genes are there, the genes will be still there, but then it will not be dominant. It will go into the dormant state, and the patient can live a happy life until 82, 83, 90 years. Yes. The activated genes produce or synthesize proteins, which gives the individual a character. For example, a father may be tall, fat, round-faced, very hot-tempered, psychotic individual. The mother may be soric, normally built, mild, timid, apprehensive individual. Okay. So here Vijay sir is giving an example of a husband and wife. The husband will be an angry, psychotic man, and the mother can be a mild, soric person. What about the child then? The child, which genetic expression the child will take? The child might take up the soric traits of the mother and have the same nature and stature of the mother, with a few properties from the father. Yes, it is not full and full from the mother side alone. The child will take predominantly from the mother and a little bit from the father. So this is a dominant miasm. That is, Sora is a dominant miasm in this child. This child will have a physical makeup, mental makeup, and susceptibilities of Sora, and hence it will be Soric constitution. In future, when the Soric defense is found insufficient to counter the adverse circumstances, it is liable to a change in the constitution from Sora to psychosis. That is the dormant or the recessive traits of father. See, so the constitution can be changed from SORA to psychosis to syphilis. It will change in the structure of the body, and even the medicine can change from miasm to miasm in the same person. The constitution also can change. So in case of a lady who was predominantly soric with timidity and anxiety, uh, dominating her nature, and if after marriage or after being deceived by a partner, she gradually becomes strong, positive, angry, manipulative, so that she has to survive the adverse conditions and not let others take advantage of her. She may change the miasm or defense from Sora, that is timid and anxious, to psychosis, that is positive and manipulative, which can be in the same remedy. Sorry. So this is the example given by Vijay sir, where the person begins the life with Sora, and after marriage or after getting deceived and all this, the defense mechanism of Sora is not enough, and then it changes its gear and it goes into the sly, manipulative, or more strong, courageous person. Then what about the timidity, and now what about the courage, cowardice and the courageousness, opposites? So how is this possible? So this is the development, or this is the adaptation. And for that, the patient is using the second gear, that is the psychotic gear. This can happen with the same remedy. For example, lachesis. Lachesis in the soric phase of defense, when suffering from inflammatory diseases of respiratory tract, etc., will be timid anxious, suspicious. But once it changes the defense or the miasm to constructive pathologies, it switches its genetic traits to manipulative, sly, positive, creative, more or less bolder than before to get its work done by hook or crook. Okay? With this obvious activation of psychosis genes at the mental level, the physique also starts reflecting the change to obesity, rounded features, etc. Are you with me? First, the psychosis, mental symptoms happen when mentally the lady changes into the psychosis behavior, automatically the rounded features follows of the body. If the other dominant trait is syphilitic, the person might change from Sora directly to syphilis type of personality. Example, Lactosis again with extreme suspiciousness, extreme jealousy, hatred, malice, oversensitive to touch, with suffocative tendency, bleeding, destructive bluish pathologies at the physical level. Yes, so what had happened here? According to the need of the patient, from Sora, even though predominantly it was Soric, the Sora is immediately over because of the harsh life situations. From Sora, the person jumps into the psychosis or it jumps into the syphilitic, according to the thought process. If the thought process are so violent, immediately it takes the help of the syphilitic defense. This can happen in the same person. So the constitution will change accordingly. Either it can be the same remedy or there is no rule that it has to be the same remedy. According to the situation or according to the miasm, the body is changing, the mind is changing, the remedy also will change. But most of the remedies are tri-miasmatic. Most of the remedies, no, all the remedies are tri-miasmatic, and everything which we see in the world are tri-miasmatic. Every person is tri-miasmatic. Only thing is, it can be predominantly soric, predominantly psychotic, or predominantly syphilitic. Now, many of our remedies have all the three miasmatic representation in them. The mental and physical symptoms of the respective miasms will be uppermost in the remedy when the individual has that defense. So the mental symptoms, the destructive symptoms are there already in our body, but then it is not shown out now. It will come out. The syphilitic thought process will come out, and the syphilitic body disease or whatever will come out when the situation happens. If the situation is going on and on and on and on nicely, that will be very minimal, that last phase or something only, the syphilis. Okay. That's what it is. The psychosis mental symptoms, the syphilitic mental symptoms, and the gear are already there in our body, but then we don't want that now. That's why we are not making use of that now. The mental and physical symptoms of the respective miasms will be uppermost in the remedy only when the individual has that defense. Only when the individual has to take that defense. Now, coming to the next paragraph, sulfur's soric nature will be prominent during its soric or the physiologic disease state. Sulfur has got a syphilitic thing also now. Even rag seems beautiful or collecting stones, etc. So there he will be little crack. He will be little strange, crank, eccentric. At that time, his mind is eccentric. It is not that he is going and killing somebody, but then he will be living his own life. But then he will be kind of not interacting with people. Sulfur is a well-known extrovert, but then here he may not be talking to people, but then he will be going on collecting rags or talking to himself and being happy and elated. All these things are the syphilitic something going on in his mind, and his body also will be dirty and cracked and all at that time. So, sulfur's soric nature will be prominent during the soric phase or the physiological disease state. Sulfur's psychotic nature will be prominent during the psychotic disease stage, and so also about the syphilis. Thus, we have soric sulfur, psychotic sulfur, and syphilitic sulfur materia medica. This is how we have to learn every medicine. Every medicine is tri-miasmatic. Every medicine has got a soric XYZ, whatever medicine it is, a soric portion, a psychotic portion, and a syphilitic portion. Same is true with aurum met, lycopodium, pulsatilla, and all other remedies. This is the base of tri-miasmatic materia medica. This solves the question of how and why the same remedy can be timid as well as courageous, mild as well as angry, dull and intelligent, active and inactive. We generally say it as polarities and all that, no, in the olden ages. Now we know the reason. These qualities are not just polarities, but the defense or the miasmatic representation. All good? All good? Any doubt? Yes. So in the next paragraph, it is not always that a constitution in soric phase has to change to the psychotic phase of the same remedy. A soric sulfur can change to psychotic complementary, like a pulsatilla or a bryonia. If the genetic expression changes, that is the constitution changes. That if the genetic expression changes, that is the constitution changes, it has to go to one of the complementaries or relation of the previous remedy. So this is the reason why we have why we should know the complementaries or the relationship remedies. Yes, in our Metromedica, we all very often we all look into this, no? Like we have given sulfur and now the person, the constitution is totally changed. Sulfur has given him all the possible improvement in his soric phase. And now somehow the same sulfur is not working in his psychotic phase. Now the patient is having a new disease, a psychotic disease, maybe a lipoma, or maybe something else like diabetes or something, or thyroid or something, and or goiter or something. Yes, it is the typical psychotic miasm. And the patient is not getting improvement with this sulfur. Now what to do? Analyze the case, and then we know that sulfur has done all the good. The medicine what is coming up can be a relation of sulfur, a relative remedy of sulfur. So now the same person constitutionally who was a sulfur in his soric phase is now in the psychotic phase, and now he is not a sulfur medicine as such. He can be one of the complementaries. Now he can be a pulsatilla, or he can be a lycopodium, sulfur calcarea lycopodium, in that order, or it can be bryonia or something. So that is how it is. So it need not be the sulfur psychosis. And if this patient goes into the syphilis, it need not be the sulfur syphilis. It can be one of the complementary syphilitic remedy of sulfur. Got the point? It need not be, or if it is a arsalb, what to say, arsalb in the soric phase, soric arsalb. Now the patient has come into psychosis. Okay, so it is the psychotic arsalb. No, no need of, no, it is not 100% true. It need not be always the psychotic ourself. And now the patient is going into the syphilitic stage. Now, then it will be the syphilitic ourself. There is nothing, there is no rule like that. It can be one of the syphilitic complementary remedies. It can be one of the syphilitic relationship remedies of ourself. Very often we see that carbovage is a complementary of ourself. Okay, maybe in the psychotic phase, when the child is all improved out of ourself in the soric phase, now the child is coming up with lot of gaseous complaints, everything, and you give him ourself and nothing is happening. There is lot of GERD complaint all the time, or hiatus hernia, and all the time the patient is continuously burping. You give, this is ourself, I know, so give him ourself again. No, it is not working. It can be one of the complement, a psychotic complementary like carbovage. Why not? It works. And when this patient goes into the syphilitic, okay, this can be the syphilitic ourself. There is no rule like that. It can be thuja also. There are other remedies in in the complementary list or in the relationship list. You can say, okay, you know that this is ourself constitution. Then what are the probable miasmatic complementary remedies? The same miasmatic complementary remedies. What do you mean by same miasmatic? The now miasmatic, the then miasmatic constitutional remedies. Can constitution change? As per age, yes. Constitution can change, yes. Lifelong constitution same. No, lifelong constitution cannot be the same. It can change. That is exactly what we are talking now. It can be one of the complementary remedies or the relationship remedies.
Madam, how will we know if the remedy is wrong or it's only a miasmatic shift? We need a complementary.
Yeah,
Uh,
to the miasm. According to the miasm, what is the remedy? Now you will be taking the case, no? At that time, if it is still arsalb, yeah, arsalb holds good because every medicine is tri-miasmatic. If it is a psychotic arsalb, you can always give psychotic. So you can always give that R-salb. But then if you give the R-salb in the psychotic phase and you know that it is not R-salb now because it is not giving any improvement. You can always think of the psychotic complementary remedies or the relationship remedies in the chart and give accordingly, depending on the predominant miasm. Yes, the constitution will not be the same. The constitution keeps on changing from SORA to psychosis to syphilis, or from SORA directly to syphilis. There is no need that it has to go in the normal pathway. It can go the ulta way also. It can go into from SORA to psychosis, then to syphilis, or it can go from SORA to syphilis and then come to psychosis also. That is also possible. We have read about that in our previous chapter. The point is, if it is a sulfur patient, it need not be sulfur in the psychotic miasm and the syphilitic miasm. The remedy can change. The constitution can change. It cannot be the same medicine again and again. You can always try out with that medicine after taking the case, after taking the totality. If you think that it is against sulfur, give sulfur, no objection. And if sulfur works, well and good. Even in the syphilitic phase, you go give the next medicine. Again, it is sulfur, you give sulfur, or you give Baraita sulfur, or you give Aurum sulfur, or you give such kind of combinations are possible if necessary, according to the degree of the destruction. If it is the syphilitic thing, if it is too severe destruction happening, sulfur alone may not be sufficient. You may have to give cuprum sulf, or you may have to give aurum sulf, etc., or you may have to give Baraita sulf, etc. The medicine can change. It need not, you cannot stick on to one remedy for one patient. And the constitution of one patient will not be the same from birth to death. The constitution will change. The medicine will change. And the medicine can be the same also, no objection. But if the medicine is not giving you the desired result, you will have to always think that this can be, the miasm is changed. So the same miasm, the then miasmatic complementary remedy has to be selected here. This is how it is. And this is how we tackle all the pathological cases, right? And after that, we come back to the genetic constitutional simillimum. After all these symptoms are cured, after the high pathological symptoms are cured, we come back to the constitutional simillimum, because the picture will change again. The pathological symptoms are all gone, and once again the original picture will come back again. This is what is Dr. Samuel Hahnemann has also said. Like, after all these disease symptoms are gone, the disease symptoms are gone with the complementary remedy or whatever, with the relationship remedy, all these pathological diseases, the disease symptoms are gone, and now comes a proper minusing all these symptoms. Whatever is innate in him, that comes up again. And then if any disease comes in, that pathological rubric medicine will not be working here. You will have to give him the genetic constitutional simillimum again by taking the case. I shall give you an example. So, RSALB case, typical RSALB case. You have given RSALB for the respiratory complaint, for the asthmatic bronchitis. Now the asthmatic bronchitis is completely cured. Now the patient is suddenly coming up with COPD, or with a constriction in the trachea. You have given him what all thing, or some pneumonia, or some interstitial lung disease. You tried with RSALB, it is not working. Okay. So RSALB was his genetic constitutional simillimum. I have taken the case in detail and given RSALB, and it has worked fantastically, and now it is not working. Take the case again. The delusions will be changed, or the situation will be changed. There can be a lot of fear psychosis instilled into him. The same RSALB is not working. What to do? Go into the complementary remedies. Find out, pick up few rubrics, pick up new rubrics to tackle the pathological changes which have happened in the cells now. RSALB is not sufficient. Go to Thuja or any other remedy, whatever is coming as a totality, whatever is after picking up the rubrics. Whatever remedy is coming, rule in and rule out, and now the changed situation has come. The thirst is different, the thermals are different. According to the changed condition, you will have to pick up a remedy. You cannot be adamant that I will be giving RSALB alone now, RSALB only now. This is because this was RSALB some 3-4 years back. Now you will have to change the medicine to Thuja or to any other relationship remedy. Or even if it is, you don't have to always look into the relationship and make a headache there, okay? If you think that for the present rubrics, for the present pathological conditions, some XYZ remedy is right, it is apt for this totality, give that medicine. And all the pathological symptoms, the interstitial lung disease and everything, the pneumonia or whatever is gone completely. That is all gone completely. And again, no, like you know that the patient is leading a healthy life now. And once again, when the patient comes back to you, all is well, no need to repeat anything, no need to go back to the genetic constitutional simillimum unless the patient is showing any signs of ailment again. Got the point? If the patient is showing any signs of ailment, you need that the patient you know that the patient is needing any medicine, any help, then you can do the case taking again, and it will be again ourselves or that medicine, the genetic constitutional simillimum, the old genetic constitutional simillimum. So the constitution is subject to change. The constitution can change, it can travel from ourselves to Thuja and it can come back to ourselves again. Or it can be sulfur and it can go to aconite and then it can come back to sulfur again. Or from sulfur, it can go into calcarea, it can go into lycopodium and then remain at lycopodium. Or it can come back to sulfur again. So this is how the constitution changes and the remedy changes. The
Ma'am,
same remedy can do.
excuse me, ma'am. Ma'am, GCS is and constitution is different, you are telling, ma'am.
No, GCS is the constitutional constitution.
But that can change. But that can change according to the miasms.
Yes, it can change. It can change. The miasm can change. The
So
remedy can
GCS
change.
is not compulsorily. It should not be the. It need not be the same throughout the life. So that's what you
Yes,
mean.
yes, you got it. You said it, Kyle. Yes.
Excuse me, ma'am. So you said that need not be the complementary also, ma'am. It can be any other.
Yes.
Any other remedy also.
Yes, dear. Mostly it will be the complementary. You need not reduce your knowledge by looking into the complementary. Got the point? You have to take you go in the proper, our totality of case. No, your proper case taking. Do the proper case taking. Don't immediately do the cut short by looking into the complementary. Aha, this is easy. Oh, just look into the complementary or just look into the relationship remedy and give some medicine. Not like that. You take the case now and you form the analysis and the totality, pick up the rubrics and give a remedy, and retrospectively you can go and search in the relationship medicines. Sometimes it can be the inimical also, that has also happened. And that after Rustox, you will have to give epi sometimes. After causticum, you will have to give phosphorus sometimes. Yes, and once that sensitivity period is gone, once that bloody lines of the ectodermal cracks are all fully gone, and the patient comes back to the causticum state again, then give causticum, don't give phosphorus. This is how it is. The miasm keeps on changing and the constitution keeps on changing. The remedy keeps on changing. It is not a rule that if it is one sulfur means always a sulfur. No, it cannot be. It can be aurum sulfur, it can be like baryta sulfur, calcarea sulfur, or it can be lycocalcarea also. It can change. The remedies can change. Yes. This was a $1 million question in all our minds, I know. Once a constitutional remedy is given, means it will be his constitution until death. This was somehow it was a kind of a thought in our mind, no? It is not so. It can change according to the stimulus, according to the need. Yes, that is exactly what we have read here. We will read that paragraph again in page number 169. It is not always that a constitution in soric phase has to change to the psychotic phase of the same remedy. Yeah, if it was a soric pulsatilla, now the patient is come to the psychosis phase. So, okay, try psychotic pulsatilla now. Try pulsatilla again. No, it need not be pulsatilla at all now. A soric sulfur can change to psychotic complementary, like a pulsatilla or a bryonia. If the genetic expression changes, that is the constitution changes, it has to go to one of the complementaries or relation of the previous remedy. Got it? Don't take the shortcut here. Okay, the relationship remedy or the complementary remedy. Do the case taking properly, and eventually when you rule in and rule out the medicine according to the changed state, you will know that the remedy is a complementary. retrospectively, when you check, you know that, okay, this is the constitutional remedy, this is the complementary remedy, or this is the relationship remedy, and you will be so happy to have this remedy now coming up in the repertorial chart. Am I right? Yes, got it?
Yes. For example, if once you told the acid remedies are usually thin built, ma'am. So if the situation changes, if the miasm changes, can they become fat or something?
Yes, they can become fat.
Okay.
Now only 5 minutes left. Any doubts? We shall do some discussion here. If at all any doubt is there, bring it out.
Ma'am, how about giving antisoric remedies during pregnancy and soon after birth to a newborn? Usually sulfur is prescribed. We have seen that during our college days. Like, what is your take on this now with the predictive and
Correct, ma. So my take is no need to give a medicine. Reason, give a medicine. And pregnancy will be highly soric. Childbirth is also highly soric. So at that time, and it is highly sensitive also. So if the need is there, you can give in 1 potency or even in 10 potency. If a need is there, give the medicine, because you know that the child already has got an immune system of its own. The mother has got an immune system of her own. Her own immunity, as long as the homeostasis is there, that is capable of fighting the illnesses or whatever. If the vital force of the mother is all good and calm, there is no need to simply give a sulfur unwantedly. No need to give that. That is my answer to this question, Sophia. Simply, why to give a medicine? If you are planning something, recently I had a patient, she delivered also now. Our Dr. Sufaira knows her. So here she was a difficult case, and finally she conceived with Calicab 200. Okay. And with this medicine, she had lot of complications. She had got that placental hemorrhage, and behind the baby, like behind that chorionic villi and all, there was a pool of blood and all. So so that is kind of a threatened abortion. I worked out the case and found out to be Calicarb again. So now I gave Calicarb 10 very frequently. And what happened? She was admitted in the hospital for observation. They did not give any medicine. And that 7 centimeter, that collection, it reduced, and eventually it reduced all by our medicine, Calicarb 10. And fine, I was giving it in frequent doses. Why? Because it is a destruction, no? Because it is a tendency to abortion, and that is syphilis there. With Calicarb 200 as a constitutional remedy, she conceived. And with Calicarb 10 frequent doses, the bleeding also stopped, and the threatened abortion is stopped, and there is no threatening at all. And the patient was discharged with the repeat scan. Everything is found good, and the fetal condition is also good. And yesterday she delivered a baby boy, 3.4 kg. And in between, we had another complication with this lady. The child was lying in oblique position, in transverse position. Now what to do? Again give Calicarb? No. What is the medicine for transverse position? I checked in the repertory. The then totality. Now the totality. Very good, Kayalvidi. Pulsatilla. I gave Pulsatilla. And what happened? In the 8th month, can you imagine? In 8th month, the baby will not move. Yeah, in the 5th month and all, the baby can move and it can change the position. Swati is asking some question. Will changing in state happen even in autoimmune condition? Yeah, we'll come to that, dear. So what happened here is, after giving Pulsatilla, I don't know in what potency I had given, maybe in 200 or in 1 potency I would have given. The baby changed its position into that cephalocaudal position. Yeah. So now the delivery also happens. So this is how it is. When the need happens, Dr. Sophia, when the need is there, give the medicine. No need to simply bombard the patient with antisoric medicine and all that, or the constitutional medicine, unless the need is there. Now coming to Swati's question. In autoimmune conditions, will changing in state happen? Yes. Why the autoimmune is happening? Because the constitution has changed now. There is utter change inside out. The body is now attacking himself. There is no immunity, zero immunity, and whatever is there for protection is now acting against himself. That is a changed condition. After giving the PCS, that is the pathological sibyllum, After the, what is pathological simillimum? It is not only for autoimmune conditions, okay? But for autoimmune conditions, don't give the genetic constitutional simillimum. Just you have to mandatorily give the PCS. Because when you give the genetic constitutional simillimum, you know that the patient is a sulfur, and you give that sulfur in the autoimmune condition, it will backfire. Yeah, in the cancer condition or in any autoimmune condition, in the rheumatoid arthritis or Sjogren syndrome condition, it will backfire. You cannot give the constitutional remedy here. So you have to find out, you have to pick up rubrics. What symptoms are thrown out now? Pick up those symptoms, and what is the autoimmune thought process in the patient. You have to pick up the autoimmune thought process, convert that into a delirium or a delusion rubric. Then you will not miss the case. After giving that medicine in the high potency, in 10M potency or in 50M potency, you can see the changes happening in the body. So again, the constitution will change. This is the answer to that, Dr. Swati. The constitution will change from the autoimmune back to normal. Then no need to jump into the GCS immediately until the right condition is needed. Because by giving another remedy, the case will be spoiled. Sometimes the case can go back to the original, to square one. So wait, as long as the generals are all good, don't interfere. Don't interfere at all. And once the patient is becoming better and better and better, no need to repeat unless the patient is showing some symptoms. The patient is saying, I'm not getting sleep of late, or my energy levels are down. Then you know that the picture is changed now. Pick up that changed situation again and prescribe a medicine. And that medicine can be a complementary or something. Pathological constitutional simillimum will change to genetic constitutional simillimum. Yes. Yes. And don't give the genetic constitutional simillimum blindly, okay? Take the case again. After the pathological symptoms are all gone and the patient is all good, and again the patient is coming up with some XYZ symptom, if you need that, this can be ignored, then don't give any medicine, just give SL. Or if you think that no, some help is needed, if you are smelling something, if you know that the patient needs help, take the case again and give a medicine, and that will be the genetic constitutional symptom of the person. It need not be that symptom again. You are only giving an anti-psoric remedy. Oh, previously I had given Pulsatla as GCS. Now this is not coming to Pulsatla at all. This is rather coming to Sepia. Okay, give Sepia. Now the GCS is Sepia. After working out the case, you got the point. You cannot learn by heart anything in predictive homeopathy. According to the condition, it is all calculations. It is all calculations, the mathematical calculations. And you can retrospectively think, okay, I have given such and such medicine for the autoimmune condition as PCS. Now the patient has improved very well for 1 year. I have not repeated anything, and patient is now beautifully out of the autoimmune situation. Patient is going on and on very well. Okay, keep off your hands. Now the patient is come back again with something. If you think that it is very low in the layer, and if you think that it is kind of psoric and all, you know, don't have to prescribe also. But if you think that no, the patient is having sleepless nights, it is mildly some psychotic or syphilitic symptoms are showing up, you know that no, the patient needs help, take the case and give a medicine retrospectively when you know that this is a complementary or a relationship remedy of the previous PCS or the previous GCS, you know that your selection of the remedy is right.
Ma'am,
Yes.
ma'am, in yesterday one patient he asked me. So after our medicines, sometimes there is excess amount of heat generating in the body. I told them because of BMI, BMR. But these questions are coming repeatedly. Is it because of excess fiery element in them, excess of fiery element after our medicine? Is it because of excess fiery element or because of their BMI?
That is because of the sensitivity of the patient. Because what is our medicine given for? Our medicine is not supposed to produce anything in excess. If the medicine is the right one, the patient will be all in full comfort. There will be no unwanted heat production and all that. Unwanted heat production will not be there. That can be the psychosis of the patient. Very well said, Swati. You just have to comfort the patient. You just have to console the patient, or the patient want to put Hajar every day. The patient wants to see Dr. Sai Narendra every day and say a hi to you. So the patient is finding out some psychosis reasons to come and meet you. She is not a lady, okay? Yeah.
Yes, ma'am. Yes,
Coming and meeting. Yes, then she wants some comfort from you.
no, she is not lady. He's a gent.
Always coming out, no, some pulsatilla constitutions or some lactasis
Yes.
constitution or some sulfur constitution. They want to kill some time. So come to Dr. Sai Narendra. He will give lot of input, some discussion going on. No, that is psychosis exactly. Or they will be reading something unwanted from the YouTube, and they will be extra sensitive patients, and they will say, "Oh, exactly, I'm having hot flashes, I'm having this, that. I took that one dose and I'm having burning all over the body. Come run to the doctor." All these are extra sensitivity of the patient. No, you just have to comfort them. You know whether it is disease or not. Yes.
When it goes when it goes excess, no, then we have to think, no, ma'am, for changing the remedy.
If it is a psychosis kind of dialogue, you can always wait. You can always wait. You can
Okay.
always give comfort and console the patient. And you know that, no, this is really a disease. Then maybe you will have to order for a blood test to find out what is the diagnosis. If anything is wrong, you can interfere. If you think that for the comfort of the patient, you can always advise a test, a blood test. You see the serum electrolytes, see the hormonal levels, as the case may be, as the age may be. And you know that everything is proper. This itself will be a proof for the patient that he is all normal. No, you have to play psychosis when the patient is playing psychosis to you.
Thank you, ma'am.
Yeah. So we'll call it a day. It's already 11 past.
Thank you, ma'am.
Bye,
Thank
dear.
you so much, ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you
you.
so much, guys.
Thank you, ma'am.
Yes. Have a nice day.